I'm Dr. Marilyn Howarth. I'm the Deputy Director of the Philadelphia Regional Center for Children's Environmental Health. And I have with me today a co-presenter, Margaret Ferrandino, and she and I will be presenting climate change, excessive heat impacts on public health in Philadelphia. This seminar will be the first of 3 in a series talking about climate change and hopefully helping teachers incorporate climate change information into their curriculum. As you can see, the Philadelphia Regional Center for Children's Environmental Health is a joint collaboration of the Children's Hospital of Philadelphia and the Perelman School of Medicine. We have researchers and physicians from both involved in improving children's environmental health. We are funded by the National Institute of Environmental Health Sciences to do this work in climate change. The purpose of today's seminar is to explore climate change excess heat impacts, and really with a focus on Philadelphia. We'll do a detailed breakdown of this topic and the subsequent two to hopefully increase student and teacher understanding of climate change impacts on public health. As an occupational and environmental medicine physician, my orientation is toward health. And so you'll see we'll really be talking through a health lens. We hope to also enhance your toolkit as a teacher with a whole variety of resources that you can use in your classroom. These will be curated reading materials, videos, and interactive activities. The last 10 years have been the hottest on record. Not just the hottest in Philadelphia, the hottest everywhere. And that's really remarkable because if you looked at any other 10-year period, there would be some years in that 10-year period that might be among the 10 hottest, but in general, it wouldn't be those last 10. But we now are in a time frame of continually increasing in our heat and our experience of heat in general. The government has put together a series of national climate assessments done by 300 scientific experts. Each of these expert panels have been made up of a smaller group of 60 different advisory committees, and the agencies that you see on the slide are those that make up those committees. They are really representative of all of the science and health agencies in the government. And their findings are no surprise. Climate change is occurring now, not in the future, but now. And there's good evidence that human activity is a significant contributor. The latest national climate assessment that I would urge you to look at was put out in 2023, the 5th National Climate Assessment. Over the last 40 years, we can see that carbon dioxide concentrations in our atmosphere are steadily increasing. And in fact, if you look at other greenhouse gases like methane in the bottom right graph, you'll see that it's really been more than the last 40 years that we've been seeing an increase. And in fact, since 1900, the Industrial Revolution in the United States, there have been an increase in methane in the atmosphere, which really the curve has really steepened in the last 50 or more years, and that's very concerning. It is largely fuel that we're using that is important for these emissions. Coal for a long time was the largest um, uh, source of emissions, oil, and also gas. But of interest, cement making and flaring of oil and gas operations, extraction operations, are also sources of CO2 emissions. And how this works is that as we create these greenhouse gases, carbon dioxide, methane, they tend to trap the heat in the Earth's atmosphere. They absorb the sun's radiation, and the infrared radiation that comes then back off the surface of the Earth is not can't escape because of these gases. And higher temperatures can cause a feedback loop. This is why we believe that we're getting hotter and hotter, in addition to the addition of greenhouse gases. Um, Higher temperatures can cause melting ice, and that increases the warming further. As greenhouse gas emissions increase and surface temperatures increase, um, we have increasing in air temperatures that lead to more intense heat waves throughout the country. As you can see from this map, in June of 2024, the average temperature in that month around the country is really in the 90 to 100 range, which is really quite hot compared to prior years. And in Philadelphia specifically, if we looked at the years from 1971 to 2000, we only had about 4 days a year that were about up to 100, and it may be 20 days that reached 90. Well, the average in number of days in the last decade that have reached 90 is 30 days per year. And this is really a remarkable increase. And these kinds of temperature increases are predicted that by 2099 we'll have 55 days each year reaching 100 degrees. That is extraordinary for our region. And although we think about the daytime temperature a lot because we tend to experience it, what is important for our health is also what happens at night. Our bodies require the cooling of nighttime in order to regain our sense of our correct temperature and not be overheated. And as you can see from this red line on the graph, the temperatures at night are also increasing. The number of days where the temperatures top 90 are increasing. We all know, we like to sleep in cool temperatures. We like it when the temperature is below 70. And in fact, we really don't sleep well when the temperatures are in the 80s and up to 90. And so if you don't sleep well, it really interferes with your thinking the next day, your memory, and a lot of other cognitive functions. And if you don't sleep well for several days in a row, it gets that much worse. So it really does have an impact on health. And what's interesting to think about and important for the health of people in cities is that urbanized areas experience even higher temperatures than their surrounding rural areas. And in fact, areas within cities that have lots of greening and lots of trees, they have a lower temperature in general. And so as you can see from this graph, the place where the buildings are, that's really where we see the highest temperatures during the day, and we see lower temperatures in the more rural or treed areas of the city. And this is due to the urban heat island effect. The idea is that there is more surface, firm surface to absorb heat, less cooling from evaporation and plant transpiration. And so you end up with these buildings and streets retaining this heat. You also can see in rural or treed areas greater cooling from this evaporation from trees. We see trees losing fluid, losing water from their leaves, and that cools the area in general and cools the air around it. And the heat islands in Philadelphia that are of greatest note are the areas around Hunting Park and Kensington. I show you Port Richmond also on the lower right screen is a neighborhood, as you can see, row home after row home with very little green space, lots of pavement, lots of roofs, lots of streets. And this is the kind of circumstance where heat really is absorbed and stays throughout the heating season. And the excessive heat does tend to cluster in poorer neighborhoods. You can see in the map on the right the percentage of Philadelphians living below the federal poverty line. The darker shades are the areas with the greatest number of people living in poverty. And now look to the left, the neighborhoods that have the most impact from heat are those darker shaded areas. And they don't overlap exactly for sure with the high poverty areas, but there certainly is greater heat in some of those high poverty areas. And why does poverty matter? Well, when you're in poverty, you have less flexibility about what you can do. You may have less of an opportunity to buy an air conditioner. You may have less of an opportunity to use your air conditioner to pay for the expense of the electricity. You have less opportunity perhaps to travel to a place that's cooler. Can't necessarily afford the gas or the transit dollars. So that lack of flexibility really does increase your vulnerability in living in these high heat vulnerable areas. Just a graphic here from the Philadelphia Heat Vulnerability Index that tries to map both the areas of high heat with some of the energy, the area cooling centers and pools and spray grounds. And if you look, yes, there are some, but there aren't that many of those amenities in neighborhoods that have the highest heat. So what are the impacts of excessive heat? One of the things that you may not know is that as the heat increases, so does violence. We all know that we're a little short-tempered when we're hot and a little annoyed or uncomfortable, but there is actually increased crime and increased violent crime related to hotter temperatures. We can see effects on farming. We have less crop yield when the crops have less access to water. The high heat causes fast evaporation of any precipitation that does come down. And in fact, when the ground looks like this, where it's all cracked, that is not a ground that's ready to accept water. And in fact, there's a lot of runoff of any precipitation that might come. And the crops then are either even further robbed of some soil moisture. These intensifying heat waves and increased frequency of storms may cause even more erosion in areas related to farming and crops. And there's a real disruption of the typical seasonal cycles that we had expected before, which really throws off the farmers for whom it's their livelihood. And not only that, throws off our availability of food and farm produce. Now, Fish migration. We may not recognize how important it is where the fish are coming from and where they're swimming when we look at the fish in the grocery store. But it's really critically important to fishermen. When they go out and fish, they tend to have a certain range that their boat can do in a certain amount of time. But now, if the fish have migrated because they like cooler waters, fish will then go from southern waters, say for instance off the east coast of New Jersey. They may now be up near Massachusetts. Our New Jersey and Maryland fishermen are not going to be able to travel up to Massachusetts without literally moving their operations and businesses. So this has tremendous impact on livelihoods, but also on the health of people, because some of the lower cost fish, that because it's easy to get to, may no longer be available. So climate change impacts human health in several ways. There is the changing severity or frequency of health problems that are already affected by weather. And then there is the created unanticipated health threats, just because it's now in places where they haven't previously occurred. And let me give you some examples of that. So the climate causes rising sea level, more extreme weather, rising temperatures, and increasing carbon dioxide levels. And in turn, these kinds of environmental issues lead to a number of health, number of environmental issues that then lead to health problems. And so that next circle, let's start with air pollution. If we have higher temperatures and more extreme weather, we need more air conditioning and more heat. And so we have more air pollution generated by our energy system, leading to more asthma, more heart attacks, and cardiovascular disease. We have more extreme weather, maybe wetter weather, changing the habitat of some vectors. So we may have more mosquitoes, more ticks, and living in different areas and in different seasons. And so that is called vector ecology, the where these mosquitoes and ticks might find themselves, maybe in new places, maybe broader ranges. And so that can impact people who may never have had to deal with those particular illnesses before. We also, with increasing water, see increasing plant life. And that's great in some ways, but in others, it may increase those allergens that people can become allergic to, causing respiratory disease and allergies and asthma, and worsening those conditions in those people who already have them. We know that runoff from streets and combined sewer overflow can cause water impacts and microbiological contamination and chemical contamination of water. Malnutrition and diarrheal disease can also stem from those water impacts, but it can also stem from food supply impacts. There are places in the world, less so in the United States, but more in other parts of the world, where the food supply is wiped out when drought occurs. In the United States, we tend to have more ability to transport food, and so it's less extreme, although more costly for that increased transportation. There's forced migration and civil conflict in some areas of the world as a result of these kinds of food and water scarcity issues. Heat and cold related illness related to death and cardiovascular disease, in particular heat, and injuries, mental health, and fatalities from severe weather. And, you know, we think of severe weather often in what we have experienced ourselves or what we see outside. But we've known for many years that heat is actually the most dangerous of all um, uh, weather-related events, heat and drought. A close second are severe weather with hail, wind, thunderstorm, and winter weather. And these are all significant events, but it's really heat that is number one. And when we look more recently at the more recent data from 2023, we see that there are 200 weather fatalities in 2023. And when we look at the 30-year average, we still see 183, and basically far and away the greatest number of fatalities related to weather is due to heat. A very far second is a more recent occurrence, and that is rip currents. Basically, people being in the water in places where they would normally swim and perhaps not be have prior experience with rip currents, and now drowning as a result. A lot of rip currents drownings in 2023 in particular. So who is most at risk? Well, we know that if you work or spend a lot of time outside, you are most at risk. And also living in an industrial community might put you at risk of some of the hazards related to redistribution of some of those industrial contaminants. But in general, children and the elderly and those people with underlying illnesses like cardiovascular disease, asthma, and other diabetes and mental illness, these are the people who may be particularly sensitive and vulnerable to the impacts of heat. We also need to think about people's adaptive capacity. How well can they adapt to an extreme heat emergency, a number of days of extreme heat? And poverty, household poverty, community poverty are both very important features of the adaptive capacity. Those community amenities that I was referring to, the cooling centers, the spray grounds for children, the pools for swimming, these are all opportunities for people to cool down during these hot episodes, and some communities have more of them than others. So, so many personal factors get involved with determining whether or not someone will have a heat-related illness. And so certainly there's the high temperature and humidity itself, and whether or not you're having direct sun exposure, whether there's any additional indoor radiant heat sources, and that often comes to people when they're working, when there's a high heat source inside. Sometimes the elderly are inside and are afraid or reluctant to open their windows, and so they have limited air movement. People sometimes do not drink enough fluids, do not have access to fluids. And in particular, the elderly do not have the same feeling about thirst that others do. And so that's really important. They may become dehydrated without even knowing. People who are physically exerting themselves, like children running around outside, are more susceptible to the heat because they are built, they are creating heat internally that then they need to give off in order to stay in normal temperature. And when the temperature outside is very hot, they're not able to get rid of that heat and cool down. Sometimes workers have personal protective equipment on that keep them hot. People with mental health may not feel the mental health problems, may not feel the heat, and so wear a coat in very hot weather and get really hot as a result of that. Obviously, physical, how well conditioned you are, and whether you have other health problems. Certain medications put people at risk for heat-related illness. Sometimes people take diuretics that actually force them to lose fluid on purpose to treat their blood pressure and other conditions, and that can make them more vulnerable to heat. Pregnant women, pregnant people are more vulnerable to heat. If you may have recognized this, if you go out and do something strenuous in the early part of the season, maybe one of the first few days of when it's hot, you're much more likely to feel exhausted and very hot and impacted by the heat than you are at that same temperature later in the season when you're more acclimated to the heat. So that early season exposure is we see a lot more heat-related illness at that time. And also people who are older or people who have previous heat-related illness, probably because they have one of the other factors that are making them more vulnerable, but that certainly can be a contributing factor. So there are some extreme impacts of extreme heat that we should talk about in more detail. The extreme heat can hinder your body to cool itself. So it can remove the opportunity of our normal cooling mechanism of sweating and allowing that perspiration to evaporate from our skin, which is our key method of cooling our bodies. We can see asthma exacerbations and respiratory difficulties just from high heat alone. There can be heat cramps, muscles that cramp, and you can have heat exhaustion and stroke, and I'll talk a little bit more about that in a minute. There can be actual dehydration, which can affect the kidneys, and exposure to high heat among pregnant people is associated with an increase in preterm birth. And the reason we care about preterm birth is that it is associated with delayed or altered childhood development. Not to say that all children who are preterm will have problems, but there is a higher rate of altered childhood development in children who are preterm. And then there's the impacts on sleep. The hotter temperatures at night absolutely disrupt our sleep, which interferes with our mental health, our physical and cognitive health. As you can see, since 1970, the average temperature in the evenings or at night in the summer months in the United States has gone from 58 up to over 60. And in Philadelphia, it is really much closer to 70 on average. And so it is really much harder to sleep. And there are many more nights that it makes it harder to sleep. So although we really are focused on children's environmental health in our Children's Center, we do think that it's really critically important for us to understand heat as it relates to the entire family. And I think thinking about outdoor workers is very important. Heat-related illness is much more prevalent among adults. They have heat exhaustion, heat stroke, exacerbation of heart disease and hypertension. And so in general, they need to be aware of extreme heat days, make sure that they know the signs of heat illness, know how to hydrate themselves, and not just with water, with enough salt. And we can often get salt from Gatorade, from soda, from pretzels, salty snacks that we take in addition to water, and that's important to help us retain that water that we take in. And then rotating into cool environments for breaks to actually allow our bodies to cool is really important. And although this slide has a lot of medical stuff on it, I just wanted to call your attention to some of the features of heat exhaustion and some of the features of heat stroke. On the left, heat exhaustion can cause dizziness, headache, fatigue, confusion. But as soon as you take someone into a resting, cooling place, these things will go away. They will feel better. They even can have vomiting and diarrhea and muscle cramps. But again, these things will go away. But when people have no longer have sweaty skin, they actually have dry skin, and they have low blood pressure, and they are losing consciousness, having seizures, or truly combative. In other words, they're not just a little confused, but they're really sort of annoyed to the point of being almost physically aggressive. These are all signs of and stumbling around. That's what ataxia means. These are the signs of someone who is really in trouble. And these are signs of someone who would need to be taken to an emergency room. So a study was done looking at the Paris Accord agreement, and if we had signed on to it, how much heat-related mortality would we be able to save in various cities in the United States? And as it turns out, the Northeast had the most to gain by reducing carbon emissions and meeting the Paris Agreement's parameters. And in particular, in Philadelphia, if we met the Paris Agreement's parameters, we would have saved 1,484 lives just from heat-related mortality alone. And fewer than that if we managed to keep the climate at 1.5 versus 3 degrees centigrade of increase, or 500 people if we keep the temperature at 2 degrees centigrade versus 3 in terms of increase in temperature due to climate change. So although we are not where we should be, and we have gotten to the 1.5 degrees centigrade level, we still can save lives if we incorporate these kinds of changes. So what do we need to do in order to improve things? One of the things is greening of our cities. Urban trees cool the air by providing shade, absorbing solar energy, and evaporating water. There's that evapotranspiration, that where water is absorbed by trees and then released into the air through transpiration. The water vapor released absorbs heat energy in the air, resulting in cooling. And heat can cause respiratory illness exacerbation. And so by managing this heat and cooling our cities and removing air pollutants, we can improve those health impacts. And so the removal of the pollutants in particular improves air quality. This is a graph of surface temperature in rural to downtown areas. And again, we can see the surface temperature, the air temperature, and this is both during the day in orange and at night in blue. And it really matters, the greening that is shown on this graph. And so what is happening greening-wise in Philadelphia? And you've probably seen some of the gardens that are in place, and these greening areas serve lots of purposes. They decrease violence, they increase community cohesion, they provide an opportunity for this transpiration, because it's not just trees that do this evapotranspiration, it's really all plants. And so the more greening we have, the better. And there are programs in the bottom right where trees are given out to people that they can plant in their yards. Some neighborhoods, we talked about the urban heat islands, don't have the opportunity they don't have a lot of ground really where they could plant things. And so there are some programs like the one at Drexel University where they are building benches that have umbrellas and that also have planters that actually can serve as places for plants that can do the evapotranspiration and shaded areas for residents in front of their homes. So with that, I will turn the presentation now over to my colleague, Maggie Ferrandino.
Hello. So as Marilyn mentioned in the beginning, part of our purpose today is to provide materials for you to utilize in the classroom to teach your students about this topic of rising temperatures. So what we did was we put together a document of different materials you can use in the classroom. And first, I'll go over a few examples of the ones we found, and then I'll go over how to access the document with many more resources. Next slide, please. So first, for elementary students, one of the resources we found was this activity book. It's a free 20-page PDF that can be printed out for the students to use. There are coloring pages, activities like word searches and mazes, along with pages focused on reading and writing, all on the topic of how to stay safe during periods of extreme heat. There are also pages on how to prepare for an emergency plan. So those would be great for our students to work on at home with their family. But this is just a great resource for inside and outside of the classroom, especially in those months leading up to where the temperature is really going to start peaking over the summer. Next slide, please. For middle school, one of the resources we found was actually an entire lesson plan provided by NASA. What NASA did was create this lesson on how to teach students on how to read a heat map. So they provide all the data, and then students will examine heat map representations of earth science data over time. They'll discuss trends and compare data sets. So this is a great opportunity for students to utilize skills that they're already learning in other classes or are familiar with in the context of temperature change. Next slide, please. And then finally, for high school students, one of the resources we found was this web application called iTree. iTree is an interactive mapping and data website where students can explore things such as tree canopy, land cover, and demographic information in their community. On the web page, you select areas of interest, and then you can add these different layers. So on the right here is an example of what I did for my hometown of Reading, Pennsylvania. In this example, the layer is showing tree canopy, and then using the scale at the bottom, you can see that the blocks that are darker green are the blocks with more trees. So this translates to temperature, as tree canopy is a great way to reduce extreme heat, especially in urban settings, as we just discussed. But this site overall is just a great opportunity for students to not only learn mapping skills, but then how to use that data to make connections about extreme heat and the presence of trees in their community. Next slide, please. So this is that document that I mentioned earlier. What we did was organize all the materials by grade and then provided numerous resources for each level. We listed the type of material, a link to the material, a short description, and then we also included some suggestions for use in the classroom. Obviously, you are the experts in teaching, but we just wanted to help make your life a little easier by brainstorming some ideas on how to use these materials. All you do is click the link at the top labeled teaching materials, and that will take you to a folder. And then in that folder, the documents for actually all 3 webinars are already there. This one is labeled teaching materials on temperature, and you'll be able to access this and then along with the slides from today. So you can use them and reference them in your classroom. All right, that is all I have.
And we wanted to suggest that you follow us on social media. There may be other interesting activities and offerings and resources that you might find interesting and helpful on our website.